On today's show, we're discussing a major rebranding of polycystic ovary syndrome, or PCOS. This is the JAMA Medical News Podcast. I'm News Director Jennifer Abbasi. Associate Managing Editor Kate Schweitzer is here to talk about her story. Kate, thanks for joining.
Thanks, Jen.
So a lot of people know the term PCOS. Why change it now?
PCOS is now called PMOS, or polyendocrine metabolic ovarian syndrome. The short answer to your question is that many experts and patients believe the old name no longer reflects what we know about the condition. It's one that affects 170 million women worldwide, roughly 1 in 10, making it one of the most common hormonal disorders in women. First classified as a gynecological disorder in the 1930s, it's characterized by elevated levels of androgens, or male sex hormones. This can lead to irregular menstruation, abnormal ovulation, and infertility. It can also cause symptoms such as acne or excess hair growth. But over the past several decades, researchers have learned that the condition extends far beyond reproductive health. It's now known to affect metabolism, cardiovascular health, and endocrine function throughout the body. Many patients experience insulin resistance, unexpected weight gain, inflammation, fatigue, and even mental health challenges. Women with the condition also face significantly increased risks of type 2 diabetes and cardiovascular disease. So the name polycystic ovary syndrome emphasizes just one aspect of a much broader disorder. Many patients don't actually have ovarian cysts, and because the name focuses attention on reproductive health, experts have worried it's contributed to years of misunderstanding, delayed diagnoses, and fragmented care. Dr. Helena Teed, who led the process to rename the condition, told me she began pushing for a name change more than a decade ago after hearing what she described as an unrelenting outpouring of frustration from patients who felt the diagnosis simply didn't reflect their experience.
This wasn't just a simple rebranding exercise, though. How did Teed's group arrive at PMOS?
It was an enormous international effort. The process involved input from more than 50 organizations and about 22,000 participants around the world. The group considered dozens of possibilities. Some names were eliminated because their acronyms had unintended associations. Others were rejected because they focused too heavily on fertility or reproductive health. Ultimately, they settled on polyendocrine metabolic ovarian syndrome because it reflects the condition's endocrine and metabolic features while still acknowledging the ovarian component.
Has the new name actually changed anything for patients yet?
Some clinicians say it already has. One endocrinologist told me that under the old terminology, she often had to spend a significant portion of appointments explaining why the name didn't really fit the condition. Since the introduction of PMOS, metabolic health has moved much closer to the center of those conversations. Still, endocrinologists already understand the condition's complexity. Experts said the true test will be with adoption by clinicians in primary care, cardiology, dermatology, and psychiatry, who may not recognize PMOS as a multi-system disorder.
Okay, but changing a name doesn't automatically change medical care. What other roadblocks need to be addressed?
One major issue is the lack of targeted treatments. Despite affecting so many women, there isn't a single medication specifically approved for PMOS. Treatment still focuses largely on managing individual symptoms rather than addressing the syndrome as a whole. At the same time, clinicians are seeing growing interest in therapies such as GLP-1 medications because of the condition's strong metabolic component. Some physicians are prescribing these drugs off-label and reporting success in helping patients improve their metabolic health. But researchers say what's really needed is more investment in women's health research.
So what happens next? How quickly will PMOS replace PCOS?
Not overnight. The group behind the name change has developed an implementation plan that includes updating medical education materials, professional resources, electronic health records, clinical guidelines, and disease classification systems. They estimate the transition could take about 3 years, although some experts think it may take considerably longer before the new terminology becomes routine. After all, the effort is about much more than swapping one acronym for another. They see it as an opportunity to reshape how clinicians think about the condition and ultimately how patients are diagnosed and treated. As Dr. Teed told me, the science has changed, and now the name is finally catching up.
Okay, thanks, Kate. If you'd like to learn more, we'll include a link to Kate's story in the show description. This week, we also published a piece that examines a U.S. Health and Human Services initiative to reduce prescriptions for psychiatric drugs. You can find that and all of our stories at JAMAmedicalnews.com. Thanks to Kate Schweitzer for joining me. I'm Jennifer Abbasi for JAMA Medical News. This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at JAMAnetworkaudio.com. Thanks for listening, and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.